Okay.
Hello and welcome to the Healthy Diet Prescription Program Phase 2 launch webinar. I am Amy Swanson from the Kansas Statewide Farmworker Health Program, or KSFHP for short. Also participating in this webinar are representatives from Wichita State University Community Engagement Institute. Together, we will describe an opportunity for healthy diet resources for the farm worker families you serve in your community. We will walk through the program, funding available, required elements, and the application process. This webinar is being recorded for providers to watch at their convenience. Healthy diet prescription programs are growing in popularity in the United States. They are a strategy healthcare providers can use to support patients to increase consumption of healthy foods and reduce consumption of less healthy options. These programs work to reduce barriers such as accessibility and affordability of healthy food options. In the long term, they complement other medical strategies to improve patients' overall health. There are many healthy diet prescription programs in the United States. Here are some details from one such program in Idaho, which was created for patients with diabetes and other chronic conditions being served at community health centers. As you can see, after 12 weeks, the patients were able to reduce both A1C and BMI levels. Further, the program had a positive economic impact on the community. We wanted to try something similar in Kansas, so we sought funds from Health Resources and Services Administration, HRSA, to develop and implement a healthy diet program for farm worker patients. As a part of this work, KSFHP will provide startup resources to access points willing to establish a program in their community and ongoing funding for food expenses. We believe the program will help Kansas farm worker families bridge the nutritional gap, which is often created through lack of access and affordability, while accommodating culturally preferred options. Farm workers and their families will also receive individual education, helping them achieve individual health goals in partnership with their medical care providers. While this program is still very new and we are working to expand it across the state, we are encouraged to hear the positive stories from our 2 initial pilot sites. One fond memory is about the first young child served by Haskell County and how excited he became when he received fruit at the end of his visit to the health department. Now I will pass the presentation to our partners at Wichita State University Community Engagement Institute to describe the program components, existing pilot sites, and the application process. I hope that this program will be a good fit for your community and you will consider applying.
Thank you, Amy, and thank you to the Kansas State Farm Worker Health Program for allowing Wichita State University Community Engagement Institute to partner with you in this exciting program opportunity. Today, my grant team partner, Julianne Walker, and I will walk you through the essential program components and talk about the application process. We welcome your questions through connecting with us via email, and we will provide those at the end of this session. So we absolutely welcome you to reach out to us later. When WSU CEI began work on this program, team members knew the need and the desire for a program was out there, but the barriers existed. Some being especially felt for the migrant and seasonal farm worker population. This slide shows a sample of barriers sometimes felt by the entire community, such as the closure of local grocery stores and the cost of fruits and vegetables. But others are especially real for farm workers who work long hours and they travel from home countries with familiar foods that are not found in Kansas. And they live in environments which may or may not have the tools to prepare healthy foods. When we went into this program design with these barriers in mind and work with local programs to find ways for their local programs to identify, reduce, and eliminate barriers for the patients that they serve. After extensive research, the program design team found that Kansas communities needed the ability to customize this approach to provide a program like this. So regardless of how the farm worker receives the food, there are essential pieces which must be in place, and they are depicted here. I'm going into greater detail describing each on the following slides. But as you think through these components, think about the ways your community could put these pieces together for the people that you serve. First, we have eligible recipients with eligible diagnoses. All patients must be active participants in the Kansas State Farmworker Health Program. Patients should be diagnosed with diabetes, prediabetes, hypertension, obesity, overweight, and/or food insecure. Family members are eligible and encouraged to participate in the education portion of the program. Second, access points which have this program should have a prescribing provider willing to participate and write a prescription for the program. Prescriptions must be written annually and submitted to the Farmworker program for continued eligibility. Providers can be on staff at the access point, or they can be working in formal partnership from practices in the community. Access points should work not only to gain the initial agreement to participate, but to retain the buy-in from providers to initiate the prescription process each year. Eligible foods for this program are fruits, vegetables, and beans. They can be a mixture of fresh, frozen, and healthy canned varieties. When it comes to Kansas communities, there is a wide variety of food sources. Access points participating in this program can design this portion in the best way which works for their community. Examples include establishing an internal food pantry, partnering with a local food pantry, or making arrangements with local vendors such as farmers markets and grocery stores. When partnering with a food pantry, farmers market, or local grocery stores, patients will receive a food coupon to purchase food. The access point creates an invoicing system where the vendor collects the coupons and then is reimbursed by the access point. Local grocers, including ethnic markets, can be more open to this type of arrangements as they may have greater flexibility to be reimbursed this way. Startup funding allows the expenses to establish this type of program. An internal food pantry will require equipment such as a freezer or refrigerator, shelves, or others. When creating an internal food pantry, programs should build in the steps of purchasing food, monitoring inventory, and maintaining food safety into their budget. Partnerships with local food vendors may request salary expenses for establishing these sites. When working with outside partners, programs should establish those partnerships through formal MOUs and build in a reimbursement system paying for the cost of the food. Some sites may consider a hybrid approach or both. There is no one right or wrong way, only the best way for your patients and for your access point staff. So we know education is key for many participants to develop healthy shopping techniques and meal preparation. Education may be provided by internal staff or in partnership with others. Educators can be community health workers, a dietitian or a nutritionist, medical provider, health educator, or others. Examples include nutrition information or recipe help, maybe hosting a cooking class or taking a tour of the local grocery store. The navigation of the American food system is very important for individuals that are coming from other countries. Funding requests can include expenses related to education, such as equipment to construct a cooking class. The picture in this slide is actually of shopping bags distributed to participants in Riley County, a program that's hosted by Konza Prairie Community Health Center. Cultural respect and responsibility is key for program success. There is no one-size-fits-all approach to this. Talk to people about what they want to eat and recipes they want to prepare. Access points should figure out how to make this work on an individual level. In addition to using bilingual services for written and spoken activities, you can ask, Which cultures are represented in our eligible farm worker patients? Which foods are we able to access locally that are familiar in their cultures? How can we provide education in a culturally and linguistically accessible way? Some communities may have ethnic markets that are willing to partner, providing great options embraced by your patients. Programs should also actively consider the life of a farm worker. Remarking back to the barriers at the beginning of this section, patients identified long working days, lack of transportation, and living in neighboring communities. When developing a system, the farm worker's life should be in consideration. An example can be maintaining open hours late in the day or on the weekend for access to a food pantry, or finding vendors in communities closer to the homes of the farm workers, or to reduce transportation time. Providing cultural education for vendors to improve the comfort level of a farm worker shopping there. This is a part of the continually making the program better portion of the work, because needs can emerge over time. So it may not be immediately apparent to you, but it may become more apparent later. Okay, so the thread that connects all 5 of those components is your staff. Staff are needed to shop, to educate, to complete reports and recruit participants. Volunteers can be engaged with some of the task portions of this work as well, assisting with duties such as shopping, stocking, and distribution. Staff are also needed to make connections within the clinic and the community. We have so far really enjoyed our conversations with our pilot sites, where we hear stories about the staff actively working to identify eligible patients and find ways to engage them. The startup period of the program is especially important when your staff are building trust with your patients. Eventually, patients will become an unofficial member of your staff, providing referrals to others. Word of mouth is the best way to recruit participants. So, speaking of people, I will now pass this on to my team member, Julianne Walker, to give you examples of existing pilot sites and the application process for 2022.
Thank you, Tina. Good afternoon, everyone. So as Amy stated earlier, this program received initial funding in 2021 from HRSA. It's important to note that the program works in partnership with other services that are also provided by your access point. The Kansas Farm Workers Health Program considers the healthy diet prescription very similar to a medical prescription written for each of your patients. And while funding for this program is appropriated on an annual basis, increased program and patient participation will emphasize the importance of ongoing funding as we move forward. We're thankful for the 2 pilot sites that Tina did mention earlier that started their programs in 2021. And so we're excited to just kind of give you a little bit of snippet and history on how they've been doing this past year, to give you a little bit of insight on maybe what a program in your area or through your access point might look like. So the first pilot program is through Riley County, and they receive funding being requested by Konza Prairie Community Health Center. And this was for patients that they're seeing at their satellite location within the Riley County Health Department. Tracy Sabo is a registered dietitian who works with Konza Prairie, and she's developed a system where patients can receive coupons to be able to redeem at area farmers markets and farm stores. And one of the benefits of a couple of the farm stores is that they are actually open year round. And so patients can benefit from fresh fruits and vegetables on an annual basis, and not just through a farmer's market that sometimes is typically only open a very seasonal time of the year. So as a dietitian, she can also provide essential education on nutrition and cooking and dietary needs in order to really be able to give patients a good overview of what the program is, and also what they can expect from the nutrition from the fruits and vegetables that they will be receiving. And they do have an on-site champion who is bilingual, so she is available to work with all of the patients there that are needing assistance with translation services. And so they will plug her in for those patients when needed, so that they can provide a more holistic approach to all of the patients that are going to be coming through the Farmworkers program. They did request funding primarily for their startup funding for establishing MOUs and agreements, developing an accounts receivable system, and also visiting those food vendors to be able to put this project together. So a lot of their startup funding was really dedicated towards staff time. And they did purchase some educational grocery bags. The one that you saw previous in a couple of slides prior, they give lots of nutrition information, and all 5 sides of the bag are very beneficial to the patients when they receive them, and that's part of the education that can be offered as well. As they seek care in Riley County, they can access this program, but Tracy did also see that surrounding counties and communities were also where some of these farm workers actually did reside. And so transportation has become a barrier for some of them. And so she is actually looking to expand their program into additional service areas as well through partnerships. So that's another way that you can look at these funding dollars, is to develop community partnerships. To date, they have filled 5 prescriptions in March and also 7 in April, and have patients being able to come in and express excitement for being able to get those fruits and vegetables when sometimes they're not accessible on a regular basis. So our second pilot site that started this past year is through the Haskell County Health Department. And for this site, they set up an internal food pantry. That seemed to be the best system for the patients that they had locally, and also kind of the way that their system was set up. So a lot of their funding for startup was geared more towards purchasing things, shelving units, to be able to store canned vegetables, and actually set up what looks like a little store for patients shop for their vegetables, and to bought a large for to be cold frozen foods. So that's kind of the aim that their program has taken. Are focusing more on canned healthy options, but they also offer dried beans in addition to seasonal fresh fruits and vegetables when those are available. And so another component that I thought was unique for this program is that they have sought assistance for donations from the community for other different types of foods that can be paired with the healthy fruit and vegetable options. And so they're able to offer a little bit more substance when the clients come in and the patients come in, and they're able to pick from multiple different types of foods. So our grant team has obviously thoroughly enjoyed working with both of these pilot sites. Tracy and Robin Hull, who is the nurse who is at the Haskell County Health Department, heading up their particular program, and other staff members. We've enjoyed working with them, and they've all been incredibly patient to kind of work through some of the different facets of being a part of a pilot project. We've learned a lot along the way, and we've gathered, I think, a lot of really good information from how their programs have been set up, and maybe some of the hurdles or barriers that they worked through to get those programs going. That this second year of the pilot program, we're hoping that some of those steps can be worked through much faster, and also having them to be able to provide some good insight to other sites as they begin to develop their programs. The biggest thing I think that we've learned throughout all of this is that no matter what barriers present themselves, whether that be getting an MOU signed with a vendor, or actually trying to dot your I's and cross your T's so that you feel like you have a good policy in place to be able to make a food pantry work within your site, is that these families truly need this program, and that all of those different types of things that you may run into, the startup funding really is to help you through those barriers and those hurdles so that patients can continue to get access to the healthy fruits and vegetables that they need for their families. So we're honored to be a part of this program. So one of the stories that Robin Hull from Haskell County Health Department shared with us in the very kind of honest them open program to Tina and I that stated with excitement, obviously lots of exclamation points and some smiley faces throughout the email, said, filled our first prescription. She was so thankful because she has 2 little boys and her husband hasn't been able to work for 2 months. We also have another family coming in later today, and they should also meet the program criteria. Let's rock and roll. And I think it's just a true testament to being able to put something into place. You never know what impact that's going to have on families until you actually hear from them and their stories. And I think even just from that very first day that they opened their program, they felt like they were having a successful venture with this. So if you feel like your program is a good fit, your access point being a good fit, then the following slides should really kind of lend itself to giving you the information that you need to move forward. Funding available based on the number of patients within your county. Counties are listed, as you can see here, by funding level. And we did provide a document called Healthy Diet Prescription Round 2 that will help you kind of walk through the funding levels as well as some frequently asked questions. Only Kansas Farmworkers health programs are eligible to apply, and there is only 1 award per county. Collaborative grants are definitely encouraged. We love to see community partnerships. Access points can work together. So several different ways that those partnerships or collaborative efforts can look. We would love to hear any ideas on those collaborations. Startup funds must be expended by March 31st of 2023. And programs will, throughout this process, they will be providing program updates throughout the grant year to the Wichita State team that Tina and I and Nicole are a part of, and then also providing and completing activity reports that all of us as a technical assistance team will be looking at. So sites are asked to consider participating in activities to promote programs such as presentations and conversations with other interested sites. So we may ask for your help with that as well. Startup expenses largely fit into all 3 of these categories that you see listed here. As we mentioned earlier, the startup expenses should match the format for your program. So for example, if you're looking to do an in-house food pantry, you may need supplies or equipment such as a large freezer, shelving units, things like that. A more partnership-based program may have greater salary expenses to be able to kind of do the legwork to reach out to those vendors and those community partners in order to get those agreements put into place and signed. So we will give you the opportunity to submit a project narrative and a budget, and this will kind of help paint the picture of your project or your vision of what you would like to use the funding for the reviewers. And if needed, our WSU grant team can assist you in thinking through that based on other sites and some of the research that we've looked at on what could be a viable program for your particular community. So not included in the startup expenses are monthly food costs. At this time, Farmworkers receiving funding for food is based on household size. So an example would be the funding is limited to the household, meaning if household leaders are both participating or both have diagnosis criteria that would meet being able to get a prescription, the amount of funding would remain the same. So it would not be provided to both of those household leaders, it would be provided to one. Funding for food is reimbursed through the Kansas Farmworkers Health Program to the access point via a monthly request system. And then ongoing funding, active program sites will receive food funding as long as that program is supported by HRSA. So in addition to startup funds, active sites also receive monthly support from our Wichita State CEI team. And we meet with locations at least once a month and sometimes upon request if there are additional questions or if they're working on setting up a memorandum of understanding and just need a little bit of more technical support, we can certainly do that as well. With each site, we do work through a work plan and help to develop site customized forms and also link those sites to additional resources on things such as putting policies into practice and or memorandums of understanding. We can serve as a liaison, providing quarterly reports and annual evaluation reports. And Nicole Friend is also on our Wichita State CEI technical assistance team, and she is the one that helps us with that. As those program pieces are coming into place, the team can also connect the sites to work with their case managers, their farm workers program case managers for additional support and help to also engage patient populations maybe in a little different way. So as of right now, the Wichita State team for this project includes Aaron Davis and Jessica Smith, who are providing more administrative support for the project. And then, as I mentioned, we have Nicole Friend, who is our reporting and evaluation expert on the team. And then we also have Tina and myself for program support. If you are considering applying, please feel free to reach out to any of us on the team. We'd be more than happy to answer questions, provide examples and samples to help you move forward in this process to apply for the funding. Applications for program funding will be entertained until the annual funding is expended. So the Healthy Diet Prescription Round 2 document for the application and link will provide you more details on that particular piece. The application process is intended to cover most of the bases, help you review the award process, and then technical assistance begins as soon as the notice of funding is sent. So we will then step in to help project sites begin to work immediately and help you work through those steps as you conclude your grant through March 30th of the next year. So with that, we know that's a lot of information, but we are happy to provide any technical assistance at this point, answer any questions that you have on funding. You can direct those to our Wichita State Community Engagement Institute team that we've introduced today, and we thank you all for your time.
Thank you for joining the webinar and learning more about the Kansas statewide Farm Worker Healthy Diet Prescription Program. We hope it'll be a good fit for you and your community and hope to see your application soon. Thank you.